Well, they are grim facts. It's estimated that nearly 1.5 million Americans were diagnosed with cancer last year, and more than 500,000 people died from different forms of the disease.
A local doctor says those numbers prove we need to be willing to try new and alternative treatments to meet this crisis head on. And as our Kathleen O'Toole reports, he's doing just that.
It's the kind of diagnosis those of us who are healthy can only begin to try and understand. The doctor tells patients, you have terminal cancer. One reaction from some patients is to try and research and find anything new, a novel treatment perhaps. And that's where a Boca Raton doctor is stepping in.
Look at this place, how peaceful.
It's Natalie and Bernie Weinstein's first trip to Murakami Gardens.
You forget sometimes when you're working all the time, you know, the serenity of a place like this.
The scenery is tranquil, and the Weinsteins have learned to enjoy everything a little bit more since Bernie's diagnosis of prostate cancer.
Everything stopped in our life.
At first, Bernie was in full remission. Then tests showed the cancer was back with a vengeance.
Then all of a sudden, it started moving.
Time sort of stopped for us, and then it wasn't so good.
I've been treating him for 2 years.
The Weinsteins met Dr. Mark Rosenberg of Boca Raton, board certified in emergency medicine, not oncology. Rosenberg's a research scientist who turned to cancer when it hit close to home.
About 6 years ago, I diagnosed my mother with metastatic lung cancer. So I started looking at the literature to see what we can do for her, looking at the studies, and I was amazed to find that standard of care really had nothing to extend survival for metastatic lung cancer.
Dr. Rosenberg's mother eventually passed, but his research went on, showing chemotherapy has what he calls, quote, a disappointing extension of survival for metastatic cancers. Yet his alternatives ran afoul of the Food and Drug Administration.
When a patient is terminal in other countries, the physicians and the patients have the latitude to try experimental drugs or protocols. But we don't have that leeway here in the United States.
So the doctor goes south to Bogota, Colombia, and his clinic where he takes terminal patients for treatments they couldn't get stateside.
And here we see a patient who...
Dr. Rosenberg narrates as a Colombian woman gets a treatment called Coley's toxins. It's a type of immunotherapy developed in the late 1800s that produces shaking, chills, and fever. It had some favorable results in the U.S. until the FDA stopped its use in the 1950s.
After receiving several months of Coley's toxins, her latest scan shows no evidence of cancer.
Bernie Weinstein went to Rosenberg's clinic in Colombia for Coley's toxins, and while it didn't work, he's still under the doctor's care, recently starting personalized chemotherapy.
Every cancer is genetically unique, and it's constantly mutating. So the idea of using the same chemotherapy drug on every patient with the same cancer does not make sense.
We're buying time. And I believe that. We're buying time.
Chemotherapy, says Rosenberg, is not a cure to metastatic cancer, but a stopgap until something real is found. And he hopes that something is a drug he's developing in Colombia. The cancer cell processes glucose, the blue ovals, for energy. That makes lactic acid or lactate in hydrogen that's toxic to cancer. So the cell pumps it out. Rosenberg's drug, the red circles, blocks the cells. The lactate builds up, the pH level drops, and the cancer dies.
I think it's not fair to allow dying patients who've been given up on it and have no other options. Why not get this done in another country and try it?
The circumstances in which I felt a patient needed to leave the country to get good care have been few and far between and almost non-existent.
An oncologist with the Palm Beach Cancer Institute, Dr. Robert Green, is not familiar with all Rosenberg's work, but he says personalized chemotherapy is a widely accepted technique. Still, Dr. Green feels care must be taken with the emotions of end-stage cancer patients.
It's very difficult because you don't want to take away hope, but you also don't want to give false hope.
The Weinsteins credit Rosenberg with getting Bernie's weight down, tackling his sleep apnea, getting him in fighting shape for the battle of his life.
There is no cure for cancer now. We know this.
Yeah.
What we have to do is we have to keep Bernie alive until there is one.
It makes you feel good. It makes you feel that there's hope at the end of the tunnel.
The drug Dr. Rosenberg hopes to use to attack the cancer cells pumps is still in the developmental stage. He says he won't be able to continue to personally take care of patients much longer. He says it's too devastating emotionally. Now, to contact the doctor, go to our website, WBPF.com, and while you're there, tell us what you think by leaving a comment. Kathleen O'Toole, WBPF 25 News.